Hello, welcome to our frequently asked questions, and a common question that patients ask me is what happens after a facelift procedure. My name is Dr. Julian De Silva. I'm a London-based oculofacial, cosmetic and plastic surgeon, and certainly after I've treated patients for facelift surgery, most surgery I do either under sedation anesthesia or general anesthetic. Now, I find with sedation anesthesia, patients recover very quickly, and half an hour after surgery, most patients are able to leave the hospital or facility. I personally ensure that every patient that I treat has an experienced nurse look after the patient overnight, and that means I can rest assured that that you as a patient are having the best possible care and are comfortable and relaxed. I personally see every patient the morning after their surgery, and I check everything. I check the appearance of the face, the level of swelling, and check that you are comfortable and relaxed, and at that point patients are able to go home. General anesthetic can be a little bit different because the recovery after general anesthetic is generally longer, and an average recovery is generally 4 to 6 hours, which means you're really required to stay in hospital overnight, and often you can feel a little bit groggy in those initial hours. By the following morning, you'll be able to go home. I personally would see all patients before they go home, and just to check the swelling, that everything is looking completely fine before you make your journey home. Most patients feel relatively comfortable after 24 hours after the surgery, and the main aspects with healing tend to be swelling and occasionally bruising. Levels of discomfort, well, from my experience and patients that I treat, although I give every patient analgesia, I find well over half my patients never need to take analgesia and generally don't need analgesia for more than 24 hours, and so discomfort and pain is relatively unusual. The main things are swelling and occasionally bruising. Thank you for your question. I hope this has been useful.